Good morning at NTV. Arafat, let's have this run already. Foods are high in sugar, just so you know, for those of you who are not paying attention while you're having this lockdown. Foods high in sugar, salt and fats, and sugar-sweetened beverages are currently increasing on the Ugandan market, if you've been paying very keen attention. Yet they have a direct impact on the overweight and obesity, and they are key contributing factors to premature morbidity and mortality due to the non-communicable diseases. Now, to speak to us about this and more, we have Nkasima Janet, the Programs Manager at the Advocacy and Partnership at the Center for Food and Adequate Living Rights, who are working to enlist food nutrition labeling in the fight against non-communicable disease. Good morning, Janet.
Good morning.
Now, the key thing here for me is adequate living. That is it's very patent in this kind of statement. What does your organization do basically?
Well, thank you very much, and good morning, everyone. The organization it's a human rights organization that works and uses a human rights-based approach, or uses human rights to promote the right to adequate food, the right to health, and adequate living in investment systems and trade.
Okay.
So we basically look at the law, but not in the general way that everyone looks at it. We want to use a human rights-based approach, or where you interpret the law in a human rights way to promote this.
Okay. Now, that said, the most important here is, what do you mean by nutrition labeling?
Yes, nutrition labeling is something that seems very simple. It's what you see on the profiling or marks that you see on a packaging, on a food or beverage packaging. But for nutrition labeling, actually, to amount to nutrition labeling, World Health Organization, through the Codex Alimentary, it's a document, a guideline. It states and guides on what nutrition labeling actually is. And these are simply marks that are put on a product to inform the consumer of what they're actually taking. It must be detailed, informative, and understandable by the consumer.
Before they consume.
Before they purchase or consume. So if something is written, say, in Chinese, and is being sold in Kabale, my grandmother buys it but cannot understand what has been written on the product.
Oh, yes.
That does not amount to nutrition labeling.
Okay.
Because she has not interpreted, she has not understood.
And she's just buying.
She's just buying.
Then how can we use this to fight against the non-communicable diseases?
Yes, nutrition labeling is very, very important, because it gives the consumer an informed choice on what they are going to eat. If a product is very high in sugar, salt, and fat, and I'm one person that has, say, diabetes, or is fighting against getting diabetes or cancer, nutrition labeling will help me to know that, oh, this product has sugar of this percentage, so I should not consume it. But where we have, for example, what is happening right now, or what we have on the market currently, is so scientific. The nutrition profilings or labels are very scientific, that it's sugar, 10 grams, saturated fat, 5 grams.
That's the thing. The language is not friendly to the consumers.
Is not friendly to the consumers. They are not able to interpret it. So nutrition labeling helps in a way that it gives the consumer information that what you're going to eat has this much sugar, so you need to take this precaution. It has this much fat, so you may take it or you may leave it according to the kind of health that you want to have. But where we have a situation of what we currently have, the consumer does not know what they are eating.
Of course.
I cannot interpret the grams, the 0 point something.
Yes.
Even whether educated or not, you may not be able to understand. So you may want to protect yourself or your health, but you're not able to because you do not have the information that can help.
Then, Janet, now that brings me, how best should the manufacturers package or label nutritionally that it's easy for me to read, to understand it? Can they label it and say, in case you have diabetes and all that, please don't take this product? Will that help?
There's what we are advocating for, and what also the World Health Organizations and other, even the Ministry of Health has recommended, which we call the traffic light kind of labeling. If something is so high in sugar, let it have red or a color code. Let me give an example of tobacco. Tobacco products or cigarettes, you see the picture that is on those products, it is scary.
Yes, so you take it, you know what you're doing to
You
yourself.
take it knowing what you're doing to yourself.
Oh, yes.
That is what we want with these beverages, the sugar-sweetened beverages, and these unhealthy diets. That if something you've produced or you're marketing is so high in sugar,
you should label.
You should label. Don't put it at the back of the packaging, or some of them you actually find the label is below the packaging.
That's true.
When I'm buying, I may not get the time to open and read, but yet the name of the product is so big and covering the whole, the whole package. So we want to see on our markets labels that are easy for someone to see, understand. Where we are using colors, if sugar is so high, use say color red, so that I know danger. I'm going to eat it, but I need to take precaution.
I need to work on it.
If it is low or moderate, use maybe yellow, like we see the traffic lights.
Yes.
So that, okay, if I take this much, I should take this precaution. Then if it is okay, healthy and very fine,
green.
Put green. So that I know that this is good for my health. But what happens now, we can't know, we just...
Now, that brings me to the question then, Jeanette. What is the organization, because it's using the human approach-based model to make sure that these are actually addressed from the framework policies and in Parliament. What is the organization doing to, to encourage the nutrition labeling?
Well, the organization is doing quite a lot of work.
Like?
To start, we formed what we call an advocacy working group, which is a multi-sectoral kind of group that has, that is consisting of academia, government agencies like the Ministry of Health, CSOs, and other professions that are working towards promotion of health diets. Now, through this advocacy working group, we run a number of campaigns to inform people about actually what they need to know, so as to understand what they need to eat to protect their health. And in addition, we've organized a number of meetings, and today, actually, we have a national dialogue.
Where? Is it going to be online?
Yes.
Perfect.
We have a national dialogue that everyone or anyone can join in to know what actually they need to understand about nutrition labeling. What should they eat? What do they need to look out for when they are purchasing anything from the shop, supermarkets, anywhere? So the national dialogue is going to be online, yes, and whoever would like to join can just get a link from our
So we get the link from your digital platforms?
Yes.
Before you leave, you're going to give us the digital links. Why are our manufacturers not adhering to the standards? Because I'm sure there are standards to this.
Yeah.
You as an entity, I'm sure you've made quite a commendable research about this. Why possibly we are not adhering to the guidelines?
Yes. Currently in Uganda, we do not have a national standard.
Okay.
But we are following the Codex guideline that I talked about.
Can you imagine?
Which is an international document.
Yeah.
And being a guideline, it's voluntary. Implementation is voluntary. And then we also have the East African standard, which is currently under review.
Yeah.
And so these are the only documents we've been using on labeling. As a country, we do not have a specific document on the standards
to guide us on the labeling.
Yes, what we need to see on our market. And like I've said, the ones that are in place, they are guidelines. They are voluntary. You can follow, you may not follow. But we've had discussions with UNBS, and we hope that they will be doing something. We want to see a national guideline in Uganda.
Of nutrition.
We have the Food and Drugs Act. Under the Food and Drugs Act, I think Section 41, it requires the minister, who is in this case the Minister of Health, to come up with guidelines or regulations on standards of the food that we have on the market. The act is, I think, 1930 something. But up to date,
it's not being used.
We do not have any regulations.
We need to review, and we need to go back to the framework.
And we need to have these regulations in place.
I'll take what you say, because it's right. When my friends come from abroad and they come to Uganda, they love to drink a lot of our sodas and our beers. Now, this is what they say. They say our beers are sweet and our sodas are extremely sweet, because the law here maybe is a little bit, you know, not that so strong. Because back in their countries, every manufacturer, the more sweet your soda is, the more taxes you pay. So they have to stay within, and the laws are very stringent.
Maybe I could comment on that. We are having also an issue that actually we are trying to address. Like you've highlighted, there is need to look at our taxation of these, especially the sugar-sweetened beverages.
Okay.
Currently, we tax according to the liter of the drink.
Yes.
Not according to the sugar content of the drink.
Yes.
And this gives the freedom to the manufacturers to put 10 spoons of sugar in a 350 ml of soda.
That's too much sugar.
Which is a lot of sugar for someone to consume.
Yes.
And it's so unfortunate that even with this a lot of sugar that they put, these drinks are being marketed to very young children.
Oh, yeah.
They are actually also being marketed by children to encourage their fellow children
to drink the same.
In schools, they are supporting, if you see these sports days, speak days, you'll find some fizzy drink sponsoring. And when you run and win the race, you get a free soda.
Oh, yes.
You get a free drink.
Yeah.
So the more you win, imagine how many tablespoons of sugar you will take by the end of the day.
Enormous.
And you know, there's a challenge that what we learn as children is what we practice when we grow
we
up.
take it up.
So it affects us in the long run, and that's why we are seeing so many cases of very young people dying at a very young age to these diseases that before we knew someone to have diabetes would be like someone above 80.
Oh, yes.
But right now, someone in their 20s can be having diabetes.
And they're dying.
And they're dying.
Very absurd. So how can those who want to join your fight in nutrition labeling join you? I understand there is a conference, yes, but post the conference, I'm sure there has to be residue conversations we could possibly tap into.
Yes. The conference today is actually just the first one. We have more that are coming. For today, yes, you can join the discussion. And also, going forward, I think this is not a battle of just safe route.
Oh, yeah?
Because it is everyone's right that is being affected. It's everyone's health. It's the public health of almost every Ugandan that is being affected. So it is upon us to speak out loud about these issues through them. And we want to thank you, NTV, and also call upon the other media houses that we need to speak about these issues.
True.
Because they are very important. Today, it's someone in your neighborhood that has cancer, diabetes, and so on. Tomorrow it could be in your house because you're not there to see what your children feed on. Right now you're here, or we are here. Our children back home, there's a maid taking care of them. You left money, Zaka Meza.
They can buy whatever.
They can buy whatever they want. So it's upon all of us to speak about these issues, call upon the duty bearers to do their work, regulate these foods.
Well, we are in the pandemic, Janet, and where Ugandans have turned to all manners of concoction. Is nutrition labeling helping here? Can it be able to help? Because there are concoctions of, there is a lot. At times I get confused when I'm online, when I see people that you get eucalyptus, then you get orange pills, then you get, it's a lot going on. How dangerous is this to us now that you're talking nutrition?
Yes, actually this is very dangerous because we do not know what we are taking. Someone goes to the nearby bush and collects everything and boils it and takes what they are taking. They do not, and you know so well there are some plants that are not good for human consumption. So though it's good that the Ministry of Health has come out and informed people to stop what they are doing or to regulate on what they are taking. But also, like you've said, about the nutrition aspect and COVID-19. From the beginning, from last year when COVID-19 came in, the very first medicine that was recommended was food.
True.
What we are eating. Because the food we eat can either make your immunity or destroy your immunity. It can either make you or destroy you. So the safety of the food is very important. But how can you know how safe the food is if you've not had access to information about the food?
About the food.
So that's where nutrition labeling still comes in. That for you to determine whether the food is safe or unsafe for you to consume, whether the food is good for building your immunity or it is going to destroy your immunity, it comes back to the labeling.
Wow.
So it is that important.
That's critical.
Very, very important.
So during the COVID-19, we should look out for foods that boost our immunity.
Yes.
But we can best do that with the labeling, which we already don't have in most of these supermarkets. Because if I'm just going to buy chicken, I see the way it is. If I'm buying beverages, especially beverages, there is quite a lot. And the thirst that comes with the buying, the purchasing, I need this kind of soda just to gallop it down your throat, and you just want to calm your thirst down, but you're taking quite a lot.
Yes, but we need currently. You can also look at the labelings that are available. For now, it's what we have, so we may need to use what we have
as you
now
wait for
as we improve it, as we advocate and also try to improve it. So if you're purchasing something, be cautious. Do not go and buy because there's now a time when, say, supermarkets or big retail shops want to discard of certain goods because they're about to expire and they are so cheap. Then you go because you want to have a lot at home and it's now cheap, you just buy. Is that food safe for you to take home and consume with your family? That's what you need to know. Because you're going to take it today, tomorrow is the expiry date. And you know, when that expiry date is, say, 30th, be sure that the 3 days before 30th,
it was already expired.
That product is not good for you to consume. So we need to be cautious of what we are buying. I understand right now most people are depending on shops and supermarkets because we can no longer go to the village and collect some food.
And get the money, even in the markets.
Even in the markets.
They're limited with the movements.
Yes. So we need to be cautious of what we are purchasing, what we are eating, because it is either going to make us or destroy us.
Wow. That's a conversation we are having with Janat, who comes from the Advocacy and Partnership at the Center for Food and Adequate Living. Janat, if someone wants to join this conversation, even the conference you're having online today, which I'm very much interested and I will actually attend, where can we find this kind of conversation?
You can find that conversation through our social media platforms.
And
Facebook, it is Cefrot, which is CEFROHT. Cefrot. Cefrot. CEFROHT. UG. Cefrot UG.
Okay. Cefrot UG.
Yes.
That's on Facebook.
Then, yes. Also Twitter, it's also the same thing. Cefrot UG. Then also on YouTube, there will be a live link, which is Cefrot Media.
Okay. Well, you and I need to be a part of that conversation if you want to understand what kind of foods you're eating and the impact it has on your life. That is Cefrot UG. Follow them on Twitter and Instagram, on Facebook and YouTube, and be a part of this conversation. I'm Andrew Chamagida. We'll take a break for now.